All right, I'm going to guess this next topic is the last thing we all want to think about right now, and that's getting sick and virus season. Well, we need to think about it because it's almost here. Today, the Oregon Health Authority gave an update on what to expect as we head into fall and how to protect ourselves. COVID cases, for example, are already up in Oregon, and so are hospitalizations. You can check out this data from OHA showing test positivity in the state. It's trending upwards. Last week, 14.5% of tests were positive, and while that was down a little bit from the week before, test positivity rate overall significantly up since the end of June. And patients hospitalized with COVID in Oregon have doubled from June to September. Now, one of the doctors who talked during the briefing today explained the biggest question she's getting from friends and parents and patients right now is what kind of respiratory virus season will it be this year?
And I wish I could say with any sort of certainty what kind of respiratory season we will have. But just to give you some framework, we often look to the Southern Hemisphere for our influenza season because flu is considered a seasonal virus. And this year, the Southern Hemisphere had somewhat of an early flu season that appeared to impact unvaccinated children. So although I can't say with certainty that will be what we have here, but that is somewhat of a bellwether for us here in Oregon.
All right, so we don't know for sure yet, but doctors are stressing that if we get another bad surge of COVID, flu, and RSV like last year, it could really crush our hospital systems, certainly around the country, but specifically in Oregon, because the state has a small amount of hospital beds per capita. And that is scary for health professionals who have seen the impact of this surge the last couple of years.
It is so discouraging to see our healthcare system become overwhelmed during respiratory viral season. And that leads to delays in care, it leads to canceled surgeries, it leads to long wait times in clinics and emergency rooms. And so I really urge all Oregonians to consider the tools available to them to prevent respiratory infection this season.
All right, so let's talk options to protect yourself. If you're thinking of getting the new COVID vaccine that was recently approved for anyone 6 months older and up, old and up rather, so far it really doesn't seem to be widely available in our area. The Oregon Health Authority isn't aware of any supply issues, but it doesn't manage vaccine distribution. That rolls right from manufacturers to providers. However, today OHA said it does expect more COVID vaccines to be available in the next couple weeks. Now, one other thing to mention here, the federal government just announced that free COVID test kits will be soon available again because of the increase in cases. You can order 4 free tests per household. The government says you can start ordering your tests starting September 25th by going to covidtests.gov.